Hi, I'm Keaton. I'm the new veterinary cardiologist at VSA. Well, my bread and butter is echocardiography, which is a cardiac ultrasound, as you can see behind me. That is screening the heart to see the structure and function and see where murmurs are coming from or if there's any dysfunction. We also do ECGs, which is looking at the electrical rhythm of the heart, as well as Holters, which is 24 or 48 or even 2 weeks ECG recording for collapsing dogs with signs of maybe an arrhythmia disturbance. We also do cardiac surgery, including minimally invasive cardiac surgery using the vessels in the legs or neck to correct cardiac problems. A heart murmur is turbulent blood flow within the heart, and that could indicate either a normal finding in some dogs or cats, but it can also indicate a leaky valve, maybe a shunt in the heart, or maybe an obstruction in the heart. So it is an indication to maybe look into it a little bit further in case there's any medications that are needed, maybe even surgery. A heart murmur can be graded in several different ways, ranging from soft, moderate, loud, and thrilling, or on a scale of 1 to 6 or even 1 to 4. All it's indicating is how loud that murmur is. Typically, the louder the murmur, maybe the more significant the heart disease, but this can vary depending on the actual heart disease. Having a murmur more indicates maybe we should look into it. A louder murmur just maybe gives you a little bit more of a warranty to look into it. Cats are also prone to heart disease. Unfortunately, 15% of all cats actually develop a disease called hypertrophic cardiomyopathy, or HCM for short. They can also be a little hard to identify if there's heart disease present. If there's a murmur or another abnormal heart sound called a gallop, that can also be another reason for them having a heart problem and needing investigations. Otherwise, there's a blood test that can be performed called an NT-proBNP, which can be helpful in identifying some cats with heart disease with normal auscultation findings, particularly in those older cats that are more prone, or maybe a cat about to go under anesthesia. So if your animal has suspected heart disease, whether that's because of a murmur or an arrhythmia, it's a good idea to have an echocardiogram, sometimes an ECG, before anesthesia to make sure that anesthesia is going to be safe and they're not going to have complications during, or maybe they need some medications beforehand to make that anesthesia more safe for them. Yes, we can place pacemakers, which can be surprising for some people who don't realize that we can put pacemakers into dogs. But dogs that have really slow heart rates, maybe they're really lethargic or not moving as fast as they used to, or in particular if they're collapsing, we are able to place pacemakers to keep their heartbeats going, keeping them alive and also keeping them from having clinical signs. There are several breeds prone to heart disease. A big main one is Cavalier King Charles Spaniels. If they have a heart murmur, they likely have a leaky valve, and the louder the murmur may be the worse the disease, but that's a reason to maybe look into it. Dobermans are another dog prone to heart disease, along with Great Danes. They get a disease called dilated cardiomyopathy. Unfortunately, this can be a little bit more silent in the early stages, and sometimes screening with an echocardiogram annually or every second year is helpful in dogs as they get older. There's a couple cat breeds in particular, Maine Coons, Ragdolls, Sphinx. They all have a genetic component to developing HCM, and it is a good idea to have them screened annually if possible with an echocardiogram to see if they're forming any signs of hypertrophic cardiomyopathy. Even some cats without the genetic marker can still develop that disease. That's how predisposed they are. Puppies with murmurs, they may have a congenital heart disease. The most common ones are patent ductus arteriosus, pulmonic stenosis, and subaortic stenosis. There are procedures that can be performed in these dogs with congenital heart disease. Some of them are curative. So it is a good idea that if there is a puppy with a murmur, particularly a loud murmur or an abnormal sounding murmur, for them to have an echocardiogram to see if there is a surgical procedure that will be helpful. We're able to do minimally invasive cardiac procedures, which involves access through one of the vessels, either in the leg or in the neck. So it's very minimally invasive. And we're able to use catheters and wires to go into the heart and fix a few disorders, a few congenital issues. So we are able to fix patent ductus arteriosus and also pulmonic stenosis and a variety of other diseases as well, whether they need stents, a ballooning procedure, or maybe occlusion. Well, the majority of the time when you come in, the reason for coming in is a murmur or maybe abnormal heart sound, and the first step is often to screen the heart with an echocardiogram or cardiac ultrasound, as you can see behind me. This is performed with the owner in the room the majority of the time, and dogs, cats often do not need sedation unless they're being a bit too wriggly. The echocardiogram is the main test that's performed, but we also do ECGs or Holter monitors, which is longer ECGs as well.